it's so daunting that because our systems have been so very weak, we are solving these problems as we go along, albeit with very limited capacity, with very limited resources. And the portion of the response now is such that we want to target case finding, active case finding, contact tracing and all of that. So we are hoping that our partners will come in a very, very big way to be able to focus a lot of the investments that are coming into those areas, because that is the only way we can actually be able to conquer this virus, by actually breaking the transmission, and that is done through active case finding as well as through contact tracing. You're going to have instances whereby people who may have been exposed to other people who got ill with Ebola may be roaming around freely. That speaks to why we are having outbreaks, sporadic outbreaks everywhere across the country, because people are moving freely, people who should be in quarantine. Some people are under observations and then they disappear while they're in observation and nobody knows where they've gone to. Then they show up in parts of the country that were otherwise not having any cases. So this is the challenge that we have. That's why we need a lot of investments in terms of logistics support, in terms of financial support for these foot soldiers that we want to have on the grounds. Unfortunately, a lot of the investments that's coming has been mainly targeting on creation of bed space and all of that, which understandably was the initial priority. Now that we've now have some empty beds, the thing now to do to finally conquer this virus is to focus a lot of investment on social mobilization and the like. 4,000, 5,000 people have been infected. If you also think that most of these were adults, and so if you estimate that 80% of them would have been parents, and if you consider the average household size in Liberia of 5 persons, meaning a mother, a father and 3 kids, assuming that those 3 kids are minors, that will be work out to around 12,000. So it's really quite a huge number. Again, another daunting part of this problem. So even if Ebola were to end tomorrow, we will have that magnitude of children, whose future is really totally, hanging in limbo.
Are you a parent yourself?
Yes, I am a parent.
You must feel for these children.
Oh
who are
yes,
just
I
left
do.
with
I mean, it pains my heart every time I think about them, because imagine a child is 6 years old today and the person becomes, an orphan as a result of Ebola. And what is even more risky and sort of like really very heartburning is that if you think about how these emergency responses work, so now Liberia has a lot of attention, West Africa has a lot of attention, but then the support may die out in a year or 2. There's a bigger question to ask. There's a much bigger question to ask. Would you want to be, that child, whose parent has gone off, and where there is no psychosocial support, where there is no case finding, and you're just there vulnerable? No, nobody wants to be like that. And this is not by choice, but this is some of the vulnerabilities within our system that we're hoping together we can work as a global community to be able to address. Because like you rightly point out, if these people are not being observed because there are not sufficient case finders, because there are not sufficient contact tracers to go in there and do the job of quarantining those households and monitoring them, some of them will lose the opportunity of reporting early for treatment. And then some, once they start to fall sick because of stigma and other related issues, they may flee and go to other parts of the country. And it actually will cause this thing to continue to just cycle around, which is a very, very big problem that hopefully together working with our partners, we can be able to address. But it is kind of risky, and I wouldn't want anyone to be caught in that situation that you described.